Hello and welcome. I am Debbie Powell, Deputy Associate Commissioner and Acting Associate Commissioner for the Family and Youth Services Bureau in the Administration for Children and Families at the U.S. Department of Health and Human Services. I am pleased and honored to welcome you to the 9th Biennial National Conference on Health and Domestic Violence, being held for the first time in its history as a virtual conference. As many of you know, we were originally going to be in Chicago on these very same dates at the end of April 2020. But the global pandemic prevented us and prevents us still from gathering. However, it does not interrupt our passion and commitment to violence prevention and response, and the central role of health and community-based providers in creating change. I personally thank you, each and every one of you, who have served on the front lines in health centers and domestic and sexual violence programs, and as public health partners as we work to confront COVID-19. I also thank the over 50 professional health associations and violence prevention programs that co-chair the conference, as well as the 5 HHS offices, including the Administration for Children and Families, the Agency for Healthcare Research and Quality, the Division of Violence Prevention, the Centers for Disease Control and Prevention, the Indian Health Service, and the Office on Women's Health. We thank all of our federal colleagues and community partners for their continued support and collaboration. This conference, led by Futures Without Violence's National Health Resource Center on Domestic Violence, is something we look forward to each time it's held. For the rich sharing of new research, promising practices, and shared commitment to innovative public health solutions to intimate and sexual violence. For over 2 decades, our program has proudly supported the important work of Futures National Health Resource Center on Domestic Violence. The Health Resource Center serves as the nation's clearinghouse for information on the healthcare response to domestic violence and provides training and technical assistance to thousands of people each year. Through their dedicated efforts over the years and the partnerships they have fostered between healthcare providers and domestic violence advocates, we have seen widespread systems change in the way that victims of domestic violence are assisted by their healthcare providers. It is system changes and innovative responses like these that will be featured over the course of the next 4 days during this conference. Advocacy programs, healthcare providers, and researchers have implemented practice protocols that include universal screening and education about violence. And domestic violence programs and other social service organizations have increased referrals and collaboration with the healthcare providers in their community. It gives me great hope to see our intersecting fields coming together, especially in the last year, to work towards addressing the root causes of violence in order to promote prevention. This conference provides a unique opportunity for all of us, researchers, healthcare providers, domestic violence advocates, and policymakers, to address the intersections of health, domestic and sexual violence, childhood trauma, and the root causes that contribute to violence and inequities. I look forward to our time together as an opportunity to learn, to collaborate, and to build futures that foster the healthy, safety, and well-being of domestic violence survivors, their children, and communities everywhere. Thank you so very much for joining us.
Hello and welcome. I am Shawndell Dawson, Director of the Family Violence Prevention and Services Program. I am pleased to welcome you to the 9th Biannual National Conference on Health and Domestic Violence. On behalf of our federal partners within the FVPSA program, the Family and Youth Services Bureau, the Administration for Children and Families, and the U.S. Department of Health and Human Services, I am honored to celebrate your commitment to domestic violence survivors, your innovative partnerships, and your steadfast leadership throughout a national pandemic. During this virtual conference, we are gathering and connecting with each other to stay informed about violence prevention services and to celebrate the central role of health and community-based providers working together to lead change in each state, territory, and sovereign nation. I want to personally thank each and every one of you who have served on the front lines in health clinics, hospitals, domestic violence programs, and sexual violence programs. Your work has been incredible and critical for helping families access safety, services, and support. I am in awe of what you all have sacrificed and accomplished while helping families throughout the COVID-19 public health emergency. We would not have a public health response to domestic violence without your leadership. We have an exciting few days ahead, and I want to thank you all for sharing renewed calls of action, new research, promising practices, innovative public health solutions to domestic violence, dating violence, and sexual violence. The FVPSA program is very proud to support the important work of Future's National Health Resource Center on Domestic Violence and the convening of this national conference. Through their dedicated efforts over the years, the partnerships they have fostered between healthcare providers and domestic violence advocates have seen meaningful change in the way that the safety, health, and well-being of domestic violence survivors are supported. Thank you for helping families heal and thrive. Domestic violence programs and healthcare providers and researchers have implemented protocols that focus on universal screening and education about violence prevention and have increased referrals and collaboration within clinics, hospitals, and shelters, ensuring that families are not isolated from healthcare or trauma-informed support. I am filled with hope when I think about the future of our work, because hundreds of experts across many fields have come together to strengthen the public health response to domestic violence and build up community-based services where families are counting on us to help them when they need it most. We are all working hard to deepen our work, strengthen services, and increase our ability to reach as many families as possible, including within communities of color and on sovereign nations. I look forward to our work and time together to learn, to collaborate, and to build stronger programs that safely foster the health and well-being of domestic violence survivors and their children in each state, U.S. territory, local community, and on sovereign lands. Welcome. I can't wait to witness your brilliance and learn how your actions have created meaningful change in your communities. Thank you for joining us, and thank you for your leadership.